Hello, everyone. This is Dr. Bishal Gyawali from Queen's University, Kingston, Canada. And today I wanted to talk about something that I find very fascinating. It's about geriatric oncology. As you know, geriatric oncology has emerged as a special subspecialty within the field of oncology, and it has especially been popular over the last couple of decades. People used to say that all oncologists by default are geriatric oncologists because cancer most commonly happens in the elderly population. And so if you are an oncologist, by definition, you are taking care of older adults with cancer. But, I think what that statement is trying to say, that all oncologists by default are geriatric oncologists, is all oncologists by default should be able to function as geriatric oncologists, and not necessarily assume that all oncologists do have training in taking care of older adults. But the thing that fascinates me is I have read a number of geriatric oncology studies, and it's about the cutoff. It's about how we define someone as an older adult. So all this, for example, let's say a trial which is specific for older adults, or even retrospective case studies or retrospective studies where people want to see the real world effectiveness of a certain drug or any type of research focused on older adults. And if you look at these studies, it's interesting how they define the cutoff. It's different based on where the study is coming from, and sometimes it's different even within the same country. Like some people use the age of 65 as the cutoff to define what constitutes elderly, especially in the US and Canada. Some people use 70. There are some studies that have even used 75 and 80 as very old adults, and this cutoff of 80, especially in studies from Japan, and 75 and 70 from Europe. And then there are a few studies coming from low and middle income countries where they use cutoff of even 60. And that got me thinking, like, how do we standardize this? How do we define this? And of course, we have been talking in geriatric oncology about the use of geriatric assessment tools, and how nobody should be excluded from any clinical decision making or trials based on their age alone. Age does not matter. We have seen very fit people beyond the age of 80, and we have seen people with very poor status even at the age of 60 or less than 60. So all this decision making should happen not based on the age of the person, but based on their performance status and the physical fitness. And I guess for prospective studies or for clinical trials, your criteria should be based on geriatric assessment tool results and not based on someone's age. But for retrospective studies, or for producing consensus statements on geriatric oncology and so on, how do we define what age cutoff should be, and how do we reconcile the results from all these studies all over the world that have used different cutoff values? And I think using different cutoff values is fine, because what constitutes elderly should not be based on an absolute number, but it should be based on the context of the individual country. Because if you think about it, the average life expectancy of people is quite different all over the world. And we still have countries in the world where the average life expectancy is 65 or low. And for those countries to say that older age cutoff is more than the age of 65, it does not make sense when the average life expectancy is only 65 to begin with. And then there are countries where the average life expectancy is beyond 80. And you can't expect that all these countries should have the same age cutoff to define older adults. So it can be based on different countries can have different definitions for how they define older adults, especially for retrospective studies. But for prospective studies, I think we need to normalize using geriatric assessment tools more and more, and to assess the fitness for treatment, the fitness for trial, not based on an arbitrary age cutoff, but based on their fitness to therapy as assessed by these validated tools. Thank you.